The potentially deadly coronavirus is changing protocol at O'Hare Airport this morning. They'll be screening travelers flying in from Wuhan, China, where they've had a virus outbreak.
CBS 2's Eric Cox is inside the international terminal where 2 flights from Wuhan will land this morning. Eric.
Yeah, good morning, Ryan and Audrina. Officials expect to see hundreds of travelers coming to Chicago from Wuhan, China over the next month, where it's believed the coronavirus originated from, and that number could actually be rising with the Chinese New Year just days away. And with no vaccine, health officials are trying to screen every traveler coming from Wuhan. With O'Hare now added to a list of 5 major U.S. airports performing medical checks, officials believe at least 80% of the people traveling to the U.S. from Wuhan will be screened. The first U.S. case of the coronavirus was reported yesterday after a man in his 30s flew into Seattle from China. Symptoms include fever, cough, and trouble breathing, and in extreme situations, kidney failure, pneumonia, and even death. In fact, in China, 9 people have now been confirmed dead and at least another 440 infected as a result of the virus. We talked to the director of infectious diseases here at Cook County Health.
There's a lot to learn about this novel virus, which was just identified a few weeks ago. I do think that we're prepared. I think the fact that there was communication, it seems early on.
Officials say general travelers have nothing to worry about. And just in the last hour, President Trump said that the CDC is ready for this and that they've got a plan and the country's in good shape to handle this situation. I'm Eric Cox reporting live at O'Hare International Airport this morning, CBS 2 News.
That's right, Alan and Cheryl. Those 2 passengers arriving on a flight from Shanghai were met by health officials here, but later released. They apparently had a different type of illness, but it underscores the level of concern among travelers. At O'Hare, passengers arriving from China vigilant about the virus, some avoiding Chinese airports of concern.
I just canceled that flight and then I changed another flight from come from Shanghai.
O'Hare joining a growing list of U.S. airports, adding screening, following international concern over a new virulent strain of the coronavirus, which last month originated in Wuhan, China, before spreading to 3 neighboring countries. Starting later this week, arriving O'Hare passengers who originated in Wuhan will be screened for symptoms including cough, fever, and shortness of breath, and if found to be ill, could be sent to an area hospital. Not much changing for other arriving passengers.
The general traveler, there is no need to change any behavior. It's really, at this point, affecting a very small group of arriving international travelers.
Screening also taking place as passengers leave China. Concerns heightened after the first confirmed U.S. infection involving a Washington state man who traveled to China. He's expected to recover. But in China, at least 9 people dead. This coronavirus spread person to person, though officials urging calm.
There should be no panic. People should not panic. We are really looking at a discrete population.
The World Health Organization convening a panel tomorrow to decide if a global health emergency should be declared. Officials in our area, though, say there are no confirmed or even suspected cases in Illinois.
The virus that's spreading fast through China has now come to the United States.
And in the last few hours, medical officials have announced they will start screening people who come to Hartsfield-Jackson Airport from the impacted areas in Asia. 11 Alive's Jennifer Bellamy has the very latest for us tonight. Jennifer?
Good evening. Now, this is called the coronavirus, and it's blamed on at least 6 deaths internationally so far. The concern is how quickly it's spreading. Overnight, the number of people with the virus grew to 300 in China. The patient diagnosed in the U.S. entered the country through Seattle last week after visiting the city of Wuhan in China, which is ground zero right now for the virus. Now, here are some symptoms: fever, cough, shortness of breath, and breathing difficulties. Airports in Asia and along the U.S. western coast are screening passengers from Wuhan for the virus. Atlanta and Chicago will begin screenings this week. We spoke with 11 Alive medical correspondent Dr. Sujatha Reddy about this virus.
There are about 6 strains of the coronavirus that up till now have infected humans, and now this makes number 7. The best information we have is that this came from an animal source near a town called Wuhan in China. They think it came from either land animals or possibly sea animals because this is a seafood market.
So if this sounds familiar, think back to SARS, which was also a coronavirus that killed 774 people in 2002 and in 2003. SARS also started in southern China, had never been seen before, and spread from small animals. It started off slow, but once it hit Hong Kong, SARS spread to almost every continent, 30-plus countries, including the U.S., and made more than 8,000 people sick. It took a global effort, 6 months and $40 billion to get SARS under control. Now, the best way to stay safe right now is to steer clear of anyone who is sick and to make sure that you are thoroughly cooking your food before you eat.
Coronavirus is claiming more lives in China. 9 people now dead and more than 400 others infected. The first U.S. case was reported today in Seattle. Here in Chicago, O'Hare is joining 4 other U.S. airports screening travelers arriving from China. The goal, to stop a potential outbreak here. CBS 2's Charlie DeMar is live at O'Hare. Charlie.
Erica, that enhanced medical screening will take place at the international terminal here at O'Hare. And with the Lunar New Year just days away, travel is expected to increase. O'Hare joins a list of 5 major U.S. airports that will screen passengers traveling from Wuhan, China for the new coronavirus, the strain never before seen in people.
There's a lot to learn about this novel virus, which was just identified a few weeks ago.
Dr. Sharon Welbel is the infectious disease director for Cook County Health.
I do think that we're prepared. I think the fact that there was communication, it seems early on.
A man in his 30s is being treated for the coronavirus at a hospital outside Seattle. It's the first diagnosed case of the virus in the U.S. He traveled through Wuhan, China, where the virus started, possibly at a food market, arriving back in the States on January 15th.
First of all, we'll be overly cautious.
Symptoms include fever, cough, and trouble breathing, and in extreme situations, kidney failure, pneumonia, and even death. China reports 9 people have died, and there are some 440 cases.
We may have some cancellation.
Yvonne Yen owns a travel agency in Chinatown.
I don't want that to happen again.
The SARS virus in 2002-2003 nearly tanked her business. Right now, she says it's too early to tell what impact corona will have.
We have 2 to 3 years to recover our business.
Now, there is no vaccine for the coronavirus, and health officials do have some concerns that symptoms might not display until days after going through these enhanced medical checkpoints. We're live tonight from O'Hare. Charlie DeMar, CBS 2 News. Erica.
Charlie, thank you.
Here at Chicago's O'Hare Airport, passengers showing symptoms of a mysterious illness that is spreading from China.
Those passengers were on a plane that arrived this evening from China.
They were examined by health officials after they showed symptoms of coronavirus.
As Tom Durian shows us, it was a false alarm, but they are taking no chances.
Now that O'Hare has been added to that list of United States airports, they are taking extra precautions here. And as they are on high alert, passengers on a flight from Shanghai tell us 2 people were removed for feeling ill.
The airline, they told us like there's 2 people sick and they need to go down the plane first.
Guy Shi arrived at O'Hare tonight on a United Airlines flight from Shanghai, China. The airline says 2 people showing signs of illness were met by health officials after the flight. Late tonight, word that it appears to have been a false alarm, but officials are not taking any chances. Later this week, beginning screening for all travelers originating in Wuhan, China.
Really, this is a focused, proactive response to make sure that these particular travelers are getting appropriate screening.
Travelers from Wuhan will be funneled through the 5 U.S. airports doing the increased screening. Chicago officials believe they will see hundreds of passengers in the months to come, but urge travelers not to panic.
We don't have recommendations for general airport staff or for travelers to be wearing any particular, masks or gloves.
Any passenger deemed to be showing symptoms of the virus will not be transported through the airport, but rather to a waiting ambulance and hospital. Xiaolin Hu waited for her parents who were arriving from Shanghai. They told her they were screened for general flu symptoms as the flight left China.
They have to go through the screening process after they take off and make sure you don't have fever or cough or those kind of sickness.
Precautions to keep the deadly virus from spreading in the U.S.
We need to make sure we are safe here in U.S.
At Chicago's O'Hare Airport, Tom Durian, today's TMJ4.
The coronavirus is a new illness and in the same family as the SARS, which killed hundreds of people during an outbreak nearly 20 years ago. The coronavirus outbreak started last month in China. It is now linked to 9 deaths there. Symptoms range from runny nose, a cough, and pneumonia. It can spread from person to person, and there is no specific treatment. Today, the CDC announced the first ever known case in the U.S., a man in Washington returning from a trip to China.
We are tracking the coronavirus that has killed at least 9 people, infected at least 440, and that's now crossed an ocean, the first confirmed case in North America. It's a case near Seattle, someone who'd recently been to China. Now, the patient is doing okay, and now an appeal for calm.
This is certainly not a moment for panic or high anxiety. It is a moment for vigilance.
Now, this strain of coronavirus has similarities to SARS, which killed nearly 800 people around the world back in the early 2000s. This latest virus first broke out in the central Chinese city of Wuhan on New Year's Eve. Then it spread to Beijing, Shanghai, Shenzhen, then jumped to other countries, Thailand, Japan, South Korea, and now down south, Washington state. Airports in countries around the world, including Canada, are implementing measures to identify possible cases. So look, at this early stage in the game, we thought we should call in some reinforcements to help understand what exactly the world is up against here. So let me introduce them. Dr. Danielle Martin is a family physician and chief medical officer at Women's College Hospital. Dr. Isaac Bogosh is an infectious disease specialist at the Toronto General Hospital Research Institute. And Dr. Allison McGeer, a clinical scientist with the Sinai Health System. She was on the front lines of the SARS outbreak in Toronto back in 2003. Welcome to all of you. Dr. Bogosh, maybe I'll start with you. The fact that there is a confirmed case now down south, Washington state, what do you make of that?
I think that's a really important point in the evolution of this epidemic, because what it shows is that this virus can certainly move from China to other international destinations, but also international destinations that aren't major Asian centers, and it's hitting a little bit closer to home.
Is it at all surprising that it's come here this quickly?
Not really. I mean, many of us who've been following this closely have suspected that the burden of disease in China is a lot larger than the number of reported cases. And we know when there's a large burden of illness in a country, the probability that someone can get on a plane and land somewhere far away goes up.
But Dr. McGeer, I mean, this idea that the actual number of illnesses may be larger than the reported cases, could that be true here as well in the United States? In Canada, we're talking about 1 confirmed case. Do you suspect there may be many more than that?
I don't think there's many more. I think it's not impossible that there might have been arrivals from China. You know, this clearly started in China, so it's not something that's arising in multiple places around the world. So there might have been 1 or 2 other travelers who had mild illness that was undetected. Not impossible. There's not lots of cases, though.
We'll talk about how this all evolves in a moment. But first, I want to get just some basics out of the way. So, Dr. Martin, let's say I get infected. What does that look like?
Well, we think that very often, unfortunately, at this time of year, it might look like lots of other viruses that we see hanging around in our family medicine offices and emergency departments. So cough, fever, shortness of breath. But of course, a person who hasn't traveled to China in the last 14 days, at this point, we don't have reason to suspect is likely to be infected with this coronavirus. You know, it's much more likely that you contracted something from, that your kid picked up in the schoolyard, and so common things being common, that's what we would suspect first.
So is there any more reason to seek out medical attention, to go see a doctor if you do have some of these kind of flu-like symptoms?
If you have traveled to China in the last few weeks, then absolutely, and I would suggest if that's the case that you might want to contact your primary care office ahead of time and let them know that that's the case so that they can make appropriate arrangements, make sure that you get isolated, make sure that they can, do the proper testing, etc. If you haven't traveled to China in the last 2 weeks and you've got what feels like a common cold to you, it's still probably the common cold.
Do we know how contagious this strain of coronavirus?
Yeah, that's one of the big questions that is facing the medical and scientific community now. So we know that some people have severe illness, but we're not entirely sure what the denominator is. We don't actually know how many people are walking around that have perhaps a mild infection that just aren't coming to medical attention. So the degree of efficiency for human-to-human transmission is still unknown.
Can we Can we treat it? Is there a cure, a vaccine, any of that?
No, but that's not different, in fact, from most viral infections. With most viral infections, we can support you until your immune system does the job by itself. And in the great majority of people with a viral infection, that will clear it all by themselves. Sometimes they need, extra IV fluids. Sometimes you can get complicating bacterial pneumonias and need antibiotics. So there's supportive treatment. But this isn't different from many other viruses, and there's not a specific treatment for it.
There's been a lot said about the parallels between this strain of coronavirus and SARS, which is also a type of coronavirus, and which many Torontonians, many Canadians will be intimately familiar with, and maybe induces a little bit of anxiety at the same time. In what ways are these two viruses actually similar? And maybe more importantly, in what ways are they different?
Well, another way to ask the question, I think, is, in what ways are our health care systems and our global sort of response systems similar and different? So, as we've said, this is a virus. It's a virus that has some similarities. We don't know how virulent it is or how frequently people are likely to get really very life-threateningly sick from this virus. But we should remember that, people in Canada die every year at this time of year from influenza, another virus that, so a lot of how serious a virus is depends not just on the virus itself, but on the host, on the person, how frail they are, what other kinds of illnesses they have. But our systems are much better organized now than they were in 2003. If you just look at the global response to this virus, I think we're in much better shape. I certainly hope we're in much better shape than we were in 2003 to respond to that.
In a concrete sense, what has changed? I mean, what have we learned since that SARS outbreak?
Well, there's been a number of major changes. So for starters, just the technology is significantly better. I mean, we only heard of an evolving epidemic about 3 weeks ago. And already this virus, the genetic sequence, has been made publicly available to the world in such a short amount of time. So the technology for diagnostics is certainly a lot better. And then the systems for communication between different levels of government is significantly improved. And then systems within the hospital to care for individuals is significantly improved as well since the SARS epidemic. So in a concrete way, if a patient comes in to a hospital with signs or symptoms suggestive of an infection, even if it is or isn't this coronavirus, if it's any transmissible infection through respiratory route, patients are treated in a manner where there's a minimal risk for transmission of this infection to other healthcare providers or others in the hospital.
And hospitals are taking concrete steps today?
Oh, 100%. 100% they are. Yeah. There's been lots of notifications within the hospital, especially in the emergency department, where the rubber hits the road, for patients to be certainly isolated if they have a respiratory illness, but not only that, identified if they've had recent travel within a couple of weeks to China.
Who's most vulnerable? Because when you look at, and again, I'm thinking of parallels with SARS, right? The fatality rate for SARS was about 10%. But if you break it down by age group, it varies widely, right? From older people to younger people. So what do we know about this particular virus?
Well, I think, that range in case fatality is a general truth about infectious diseases. But you're right, it does make it very difficult to assess now what an overall case fatality rate looks like, because almost certainly the cases are biased towards people who are older and more ill, and it's very likely that younger people and children are much less severely affected. But you just need a big enough accumulation of cases. I know that 300 sounds like a lot of cases, but in terms of assessing the case fatality rate, it's just not enough to really say something sensible about it.
So,
I think the other important thing for those of us who are healthcare workers in SARS was that one of the things that was very distinctive about SARS was that people were most infectious when they were very, very ill. So transmission in hospital was a very high risk. So far, this virus looks different. There does appear to have been some transmission in hospitals, but when you consider how many cases there are, next to none.
What is the biggest question mark at this point? What's the biggest sort of outstanding question?
I want to know what the source is, as I think the rest of the world does. It would be very interesting and helpful to know what non-human animal was harboring this infection before it moved into human hosts. And I think the second big question on most people's minds is, what is the degree of transmission and what is the efficiency of transmission from person to person, because that factor will really be driving this epidemic and will really, if it is not that efficiently transmitted, I think we'll be able to curb this much quicker.
To the three of you, thank you very much for your time. I really appreciate it.
Thank you. Pleasure.
Thank you.